When assessing patients across the lifespan, there's some things to be aware of as far as things that are common in each age group. When you're assessing a pregnant woman, keep in mind that some normal findings are constipation, a little stress incontinence, heartburn, and hemorrhoids are all things that you could see there. When assessing a newborn, you're going to ask the parents whether they're breastfeeding or bottle feeding and how they're tolerating that, how much they're eating a day, and how often. Sometimes parents get nervous that their newborn may not be eating enough, but you can reassure them that their infant is getting enough as long as they're meeting their growth milestones and they're saturating about 6 wet diapers a day and having at least 1 bowel movement per day. When you're looking at children, again, you're going to reassure them that their toddler's getting enough. Sometimes toddlers don't want to sit down and eat full meals, and the way they eat, they prefer to pick and have hand foods, and that's okay as long as they're meeting their growth milestones, so just reassure the parents there. You're going to make sure that they're not eating anything that they're not supposed to be, as far as dirt or clay, or paint from the walls in old homes. Sometimes pica, you see lead poisoning if they're eating paint from the walls. As far as for young children, if they're complaining of abdominal pain, there's a multitude of different things that it could be there. Sometimes you see abdominal pain when a young child has an ear infection, so it may seem unrelated, but that's one presentation that you could see. Since obesity is such a big problem in the United States, you're going to want to look and see if the child is obese and do some nutritional teaching there, as far as looking into seeing what foods are being offered to the child and what kind of body image they have there, and teach the parents some more healthy choices. For teens, what you're going to see is possibility for anorexia or bulimia, because body image is such a big issue there in that age group. A lot of times kids in the adolescent age group are skipping breakfast, and they really need that first meal in order to think and do well in school. They also need more calories than an adult would. A teenager, on average, a boy needs about 3,000 calories, and teenage girls need about 2,200. With older adults, it's not abnormal to see that their appetite is waning, and sometimes that could be due to just age-related changes. Sometimes they're not eating as well because of cognitive decline, less income if they're not working and they're living off social security, or they may not be able to make it to the grocery store often enough and just may be malnourished, so you're going to want to look at that. Also, with older adults, you have to consider polypharmacy, if they could be having any interactions between their medications that could be affecting their nutrition or their uptake or their appetite. Certain things like anticholinergics can cause dry mouth, and that may make them not want to eat or may have trouble swallowing, so that's something to look into as well. And then you're going to move on to the focused assessment for some more common complaints.